I want to say a little bit about what Mr. Ryle said. I believe he said that I believe he portrays this whole debate as kind of a contest between this federal legislation that we're talking about and no legislation at all. Of course, that's a mistake. The state legislature has done a great job in the past of working to make sure that we're moving towards everyone having access to health coverage and everyone having appropriate insurance. I'm thinking the CHIP program, which has done, I think, an excellent job of making sure that everyone has an insurance option. And of course, as we all know, in about 4 years, Obamacare is going to destroy CHIP. It's going to walk over all sorts of insurance programs that the state has already set up. CHIP is, I think Arkansas is one of 35 states that have a CHIP type program, and the concern that this bill addresses is that Obamacare is going to eliminate all these state measures, and it's going to throw everyone into one larger system. Mr. Ryle said that.
Just a minute,
yeah, sure.
Representative Walls.
I think the reference to the bill should be typed by the title, not by its use of the president's name as the labeling. Or just be, I'd appreciate it if
oh, for goodness sakes.
Stay on, if you want to call it the health care bill, that would be appropriate, but not to use the President of the United States as the label.
Why?
Thank you, Mr. Walls. Mr. Greenberg.
Noted. What exactly is the term you'd like me to use?
House Bill 1053.
No, he's talking about Obamacare.
I thought you wanted me to talk about you want me to use the appropriate term for the president's health care bill? I'm sorry, what term is that? What term would the appropriate bill be?
We're not debating the health care bill, Representative Greenberg. We're debating the bill on 1053.
Okay.
I think we've noted that. If
Okay.
you just move on,
Thank you.
Mr. Greenberg. Thank you.
So if you look at the experience of a mandate in Massachusetts, you can see that the mandate in Massachusetts didn't decrease ER usage. And so a mandate is not going to have, if you take the experience of Massachusetts seriously, which has a mandate, then there's some question about what Mr. Ryle said, which is that he's concerned about increasing use of the ER. I just think that's not borne out by experience. I liked what Representative Meeks had to say about how we need to make health care changes here in the state. And I'm sad to see that in some ways it's being framed as either we have to accept federal legislation, or we do nothing at all, or we can. Those are our only alternatives, and that's a sad thing to see. That's what 1053 is trying to avoid. I do want to say something about what Dr. Thompson said, and then I will close. I believe that Dr. Thompson explained that under PPACA, the federal health care provision, the new entrants to Medicaid will be fully funded. I think that is not correct. I think that that's a mistake. In fact, the people who currently qualify for Medicaid but are not enrolled is going to, according to the estimates of some, cost the state north of $100 million a year in Medicaid. Those are people who are currently qualified right now who are not enrolled. The federal health care program is going to force all those people into Medicaid. And when you talk about adding $100 million into our state budget, $100 million worth of liabilities, I don't see that you have breathing room for anything else in the future. And that's not at all covered by federal health reform. That new expense is not covered in the slightest. We often hear from doctors about the importance of preventive medicine. I myself am very concerned about waiting for 4 years until 2014 until the implementation of PPACA, the federal legislation. I'm very concerned that in 4 years it's going to shut down the measures we have, like CHIP, which guarantees everyone an insurance policy here in the state. And instead, we don't really know what's going to happen. This bill, 1035, it's an attempt to avoid that kind of uncertainty. It's an attempt to solve the problem. It's not an attempt to sit around and wait to see what's going to happen 4 years from now. And so when we're counseled by a doctor that we need to avoid taking preventative measures, let me tell you the situation that we're in right now. We got a Medicaid reimbursement system that pays doctors 56% on average of what they're entitled to by market rate. And the proposal is that we're going to load about 100,000 more Arkansans into this system. It's going to be completely uncompensated on the state rate by the federal government. It's an overburdened system, and many doctors, 2/3, according to one poll that I've seen, are having serious doubts about whether they want to participate in government-funded health care. And so when you're loading a whole bunch of people forcibly in Arkansas into an already leaky boat, I think that there are legitimate concerns about that. Thanks very much. I'd be happy to take any questions.